Hello. I'd like to talk to you today about stress management. It's caused by negative and positive events in our lives and our perception of them. Our bodies are designed to withstand stress and deal with it, but if we don't manage it well, we do feel the symptoms. First, you need to understand your body does not recognize the difference between good stress and bad stress. If you get a huge bonus, your body is going to respond the same way as if you got fired. Some of the signs of stress not being managed well: unexplained rashes on your body, those tiny little red dots you get on your arms or in your midriff area. You start forgetting little things. You get irritable for no real reason. Your health declines. You're feeling achy. You feel pains. You get headaches. Your belly hurts. You feel a lack of motivation and a what's the use kind of attitude. Even your blood pressure can go up. The body's autonomic nervous system controls your heart rate, breathing, vision changes, and more. Its built-in stress response, the flight or fight response, helps the body face stressful situations. That's what produces the adrenaline in our body. When a person has long-term stress, called chronic, continued stress causes wear and tear on the body. Physical, emotional, and behavioral symptoms develop, such as the aches and pains, chest pains, or feeling like your heart is racing. You feel exhausted all the time, or you have trouble sleeping. You get headaches, sometimes dizziness, lightheadedness, shaking. Your blood pressure can go up. You get muscle tension. You feel it in your shoulders, or your jaw is clenching, or you're grinding your teeth at night. You have stomach or digestive problems, trouble with IBS, colonitis, ulcers. You have trouble having sex. Your libido is down. Your immune system becomes weakened. Stress also leads to emotional and mental symptoms such as anxiety or irritability, depression, panic attacks, and sadness. People with chronic stress often try to manage it with unhealthy behaviors, including drinking too much or too often, gambling, overeating, or developing an eating disorder, participating compulsively in sex, shopping, internet browsing, gambling, smoking, and using drugs. Stress can often be difficult to diagnose because it's so subjective. There are questionnaires that can help you identify it, but there are no measurable tests that are available. The only determination of stress is your perception of your life events and what your body and your brain, how they are responding to it. If you have chronic stress, your healthcare provider can evaluate symptoms that result from stress. For example, high blood pressure can be treated and diagnosed. Stomach problems can be diagnosed and treated. Headaches can be diagnosed and treated. However, it's important to pay attention to the strategies for stress relief, including perhaps seeking a therapist. At this point in time, you also want to consider exercise when you feel symptoms of stress coming on. Even a short walk or sunshine can boost your mood and help you to feel hopeful again and decrease your stress level. At the end of each day, take a moment to think about what you've accomplished, not what you didn't get done. That leads to self-shame, self-blame, and ends up exacerbating your stress symptoms. Set goals for yourself. If need be, set it an hour out, and if you accomplish the goal, congratulate yourself. It's important to set goals for your day, your week, or your month. Focusing on that goal rather than focusing on the things you cannot control helps you to remain in control and decrease your stress level. And again, consider talking to a therapist or the member of a clergy about your worries. Thank you.